Welcome to the Vertical Wall Headache and Migraine Clinic and the presentation on the 6 critical areas of headaches and migraines. As you look at the pie graph, you'll notice the neck is a very large part of the pie graph itself. Here in the clinic, we look at headaches and migraines from the bottom up, meaning we look at the neck first and we rule the neck in or out. If we can rule the neck in, there's a lot that we can influence of any headache and migraine. On the left side of the graph, you'll notice 5 different pieces of the pie. And these 5 pieces of the pie are areas that are also contributors to headaches and migraines, but they're also areas that you as an individual can influence with changes that you can make on your own. And as we go through this presentation, we'll explain each one of those segments on the pie graph and tips and ideas of how you can change habits in these areas to help with your headaches and migraines. We'll also explain more about how the neck is involved and what it looks like when the neck is no longer involved in headaches and migraines. When we talk about headaches and migraines, we got to talk about the sensitized brainstem process. Put that on the shelf for a second as we'll speak about the idea that migraines were separate from tension headaches. And migraines were a result of a dilated blood vessels, or the blood vessel circumference was increased. And so the medications developed were meant to decrease that circumference of the blood vessel or constrict them. But what they found is that the correlation between the migraines and the blood vessel dilation was not consistent. It's very minimal to that fact. And so what they found is the dilation of the blood vessel was because of the migraine and not the cause of. And that sensitized brainstem process was specifically from the pathway of the trigeminal cervical nucleus, or cranial nerve number 5. Meaning that is the nerve that influences our facial movements, our facial sensory. So a lot of people who have headaches and migraines, they can have on one side, or it can be both sides, but it can be behind the eye, center of the forehead, top of the head, side of the head. Any of those areas is innervated by that cranial nerve number 5. And as that information goes through that cranial nerve number 5, it goes down through the lower brainstem, comes back up to the brain, gives the information the brain says, here's what you just experienced in the world. So when it's not sensitized, chocolate tastes like chocolate. But when it's a sensitized brainstem process, think of the analogy of the volume on the megaphone is turned up. So now someone has chocolate and goes through that pathway, comes back up, the brain opens it up and says, this is painful, here's your migraine or your headache. Okay? And also too, how tension headaches and migraines used to be separate, they're seeing that tension headaches to migraines is a continuum process, meaning we're talking about chronic pain. And chronic pain becomes learned behavior, hence why certain triggers create the head pain of the headaches or migraines. Chronic pain says when this happens, here's the result. So there's something that's driving that influence to the chronic pain. It's always saying, hey, whenever this chocolate is eaten or this red wine is drank or when stress levels is high, we're going to give this person this headache or migraine. So then we look at the neck and what they found, the top 3 segments of your neck or the top 3 vertebrae, the sensory nerves that come through that same lower brainstem pathway and can influence the sensitized brainstem. So if the neck is a part of the sensitized brainstem, meaning when a brainstem is sensitized, it's primed, ready to go. It's just waiting for the right trigger to create the pain. So when the neck is ruled in as a factor of the headache or migraines, then the medical red flags can be ruled out. And when the neck is addressed in a very skillful way, people have had 80% or more resolution after 12 months. And you ask why after 12 months, as we were talking about, chronic pain becomes a learned behavior. You have to reteach the body that just because this trigger happens, you don't have to go here anymore. And that's why we talk about these 6 critical areas. And these 6 critical areas are a part of all types of headaches and migraines. Stress is the #1 trigger for headaches and migraines. Stress is all parts of life. There's good stress and bad stress. We're talking about the bad stress here. So here's an example. Think about the grassy plains of Africa. You have a gazelle grazing in the field when all of a sudden the predator, whether it be a lion or hyena, starts chasing the gazelle. What does the gazelle do? Gets up and runs, fight or flight. The adrenaline's up and it's running for safety. As soon as the gazelle escapes the predators and is back to safety, the gazelle is back to grazing in the fields, meaning the adrenaline is down, the fight or flight response is gone, and is back to the relaxation mode that it was in before. Whereas humans, we are fully capable of stress, whether it be family, life, work. We can be at stress and high levels of stress for long periods of time. I mean, we're at fight or flight nonstop sometimes. And so what happens is our body's increasing the adrenaline, the cortisol, so it's preparing to avoid danger, to protect ourselves. But if it's at that high level intensity for too long, it's detrimental to our health. It's detrimental to our body overall. And some medical risks, for example, high blood pressure can be a part of it. Other risks can be as well. But blood pressure can also be a trigger for headaches and migraines. So if we decrease our stress, we can decrease our risk for medical issues that can also be triggers for headaches and migraines. We can also improve our sleep with less stress. We can also change our habits if we have less stress. Because what do we do with our food when we have stress? We stress eat. So we have ice cream, we have trash food. What do we do when we are coming home stressed out from a day at work? Do we go exercise typically? No. We typically sit in front of the TV and veg out to calm our mind, or we'll take other substances to calm our mind. So stress is the number one factor. Sleep is another factor we'll talk about. And when lack of sleep is combined with stress, it's a guaranteed trigger for a headache or migraine. Lack of sleep is a trigger for 60% of migraines and 49% of headaches. So if you have 2 nights of less than 4 hours of sleep, you're pretty much guaranteed to have a headache or migraine if you're prone to them. But what they found, two consecutive nights of good sleep, meaning 8 hours or more, is going to give you a low risk for a headache or migraine. So a good way to make sure you're getting good sleep, or try to get some good sleep, is have a sleep schedule. Go to bed at the same time and wake up at the same time. When it comes to diet, in regards to migraines and headaches, there are multiple triggers. Someone could have red wine, chocolate, red or yellow onion, a pickle. They could drink orange juice, and those could be triggers, depending on the individual. They have found that one of the best diets that you can have is a high fiber, high nutrient diet with a low glycemic index. And by glycemic, that's sugar. What they've found is that in the migraine process, a protein called CGRP is released. When they found when they take an MRI when someone's in an active migraine process, CGRP is more abundant. So the new medications that you see on the commercials, they are focused towards limiting that CGRP release or decreasing the amount that is in the body altogether during a migraine process. And that CGRP also reflects how much inflammation is happening with the migraine process. What they found also too, specific diets that also follow that high fiber, nutrients, and low glycemic protocol are the Mediterranean diet and the keto diet. They have found that those 2 diets have shown to decrease the amount of CGRP released with the migraine process. And what that does too, it also decreases the intensity and sometimes the duration of the migraine or headache. Drinking water. This is a really big one. So what they found is there's a risk for migraine increases 8% for every 9-degree increase in temperature around you. So, meaning when the temperature is increased, our body wants to sweat out the heat. And so with that sweating out becomes a lack of water in our body and dehydration. And there comes your risk for a headache or migraine. So a good rule of thumb is to drink your body weight in ounces per day. Some people say half an ounce per pound of body weight. I say for your body weight in ounces per day. What I tell the fellows is if you were to pee in the snow, you shouldn't be able to see your pee at all in the snow. You're that hydrated. So when you're hydrated, you're going to decrease the duration and frequency of your headaches and migraines. Exercise is a must. We can talk about it being a trigger versus a benefit. Classically, what we've had in the clinic are clients that have been high-level athletes, and when they work out hard or compete at high intensity, it triggers their headache or migraine. And so what do? They do nothing out of fear of creating a headache or migraine. But in actuality, what they have found, a moderate intensity or moderate level of intensity of exercise is key. Because exercise is our natural opioid effect. And it can be, when it's moderate, it can also be a pain reliever when there's an active migraine or headache. And there's also multiple benefits too of health, whether it's cholesterol, blood pressure, diabetes. It helps with stress. It helps with sleeping better. So exercise is something that is a must, but moderate level. So now we talked about the 6 critical areas of headaches and migraines. And you look at the pie chart here, you can see the 2 halves are separated. So those 5 areas we talked about that you can influence as an individual, imagine all of the good things that you're doing in those areas, all the habits you've changed, all the positive things you're doing that are creating a cumulative effect, or like the stock market, compound interest in a very positive way. Now you take away the neck, which was the main driver, the main embers for that sensitization process. You take that out. Now imagine what can happen when those 5 areas that you can influence don't have that roadblock of the neck. Now with the neck out of the picture, here is your new pie graph. Here are the things that you can control and influence that will help your headaches and migraines. Thank you for taking the time to watch this presentation. If you have any questions on how we treat those with headaches and migraines in the Vertical Headache and Migraine Clinic, contact us. We offer a free 15-minute phone consultation, and in that 15 minutes we can determine if your neck is a part of your headaches or migraines and if an evaluation is worth your time and effort. Thank you.